Hi, I'm Dr. Carlson from the Grove Animal Hospital and Holistic Center, and we're going to be discussing case number 01960, 11-month-old Golden Retriever. Basic symptom, itchy, biting at the legs. Okay, so that's our symptom. And the treatment versus remedy, the treatment tries to control the symptom. And so Benadryl and shampooing have been currently used at home to try to control. But the remedy is finding out what's the imbalance. And so as we put this all together, what can be easier to understand is we break it down. Itching and bites legs. Treatment, Benadryl and shampoo. But we want to know what's the remedy and to correct the imbalances. And since we have some imbalances, we're going to discuss those. So we're going to go to the base point readings first. First of all, we have weakness in red, stress in yellow, so there's an imbalance present. Specifically on the weak side, the SI3 is going to be the lower small intestine. It also covers the large intestine. It covers the bladder and also the lower part of the body, so the legs. The SI3 is the communication point from the back end of the body through the kidneys to the front end of the body, which is usually regulated by the brain. So that information going back and forth, it makes sense because dogs, cats, and other animals that have marking behavior, other small predators, use the SI3 to communicate to make determinations on whether I should just go to the bathroom or should I mark. So the anal glands or marking glands, urine is also a marker as well. And dogs will retain urine to mark. So if that's off, that means that we're sending off a sensory response to the brain that suggests nervousness, which was number 2 on the weak part, was the nervous system. So what's happening is that when the lower part of the body is getting affected, the nervous system sets off that anxiety response. And that's where the biting and compulsion on the limbs can come from, as well as nervous itching, because it's been shown that behavioral itching is part of a working diagnosis, and I'll explain this a little bit more. On the stress side, we had lymphatics, the upper part of the small intestine, so we know that the digestive tract and lymphatics are involved, so we know something's being absorbed that can create a reaction. What we don't see is allergies. Allergies are between that and sensitivities. If we're allergic, we've incorporated an allergen into the system that continually reacts, versus a sensitivity, which we'll look at that in a little bit here, is something if we're exposed to on a daily basis we can react to. So no allergies, but this is related to the GI tract and the nervous system. As far as the remedy, that's where we're going to focus. So we use a hemp oil infusion for 3 months, 5 drops a day, and that's going to correct the imbalance. Remember, this is not the treatment, so the remedy is going to resolve the imbalance to allow the patient to respond and to heal itself and to recover. In the meantime, the treatment, if the Benadryl is responsive, that's a safer product than you going to a steroid, but as we go through the transitional season from winter to spring, we may need a steroid to take some of the edge off, but we're going to stay away from that as much as possible. The second thing we're going to use is a product called Stomach Happy, because Stomach Happy is a Chinese herbal by prescription, 2 capsules twice a day, and that's going to help balance the intestinal tract. Okay, and then finally we're going to use B12, 1 cc every 3 to 4 weeks for 3 months. What that does is it's good for the enteric nervous system, which is in the GI tract. It's good for digestion, and it also helps to balance the immune system. So we have all of those involved, but we're treating the itching through the intestinal tract. This is not an allergy. The sensitivities, and we'll pull that up, is that the only thing that we were sensitive to is a couple of cooking oils, which flaxseed oil can be found in certain holistic diets. Grapeseed oil, because of the grapeseed and and the grape reaction in dogs. Typically this isn't something that's incorporated in dog foods or dog treats, but the flaxseed can, so that's the one to watch for. But the sensitivity list was very narrow. We go through 40,000 sensitivities and only had a couple of things. So there again, not a sensitivity in most cases, not an allergy, but you see where the dilemma can come in young dogs and any dogs in general that are scratching, is that you have to determine, is it a true allergy or not? Most traditional therapies say yes, allergy, treat with steroids, but this is coming from a different place. So once we know what it is, we're going to place the remedy, which we're doing, but also to control it with treatment if necessary. So we're going to call this number 847-541-4005 with questions, or 815-344-7716. Get your questions answered. Use the video, watch it as much as possible. But I do like client participation, so spend a lot of time, ask a lot of questions, because initially we want to make sure that we're on the same page with therapy and why we're doing it. Thank you very much.